because if you look at the risk factors for multiple sclerosis, they're the exact same risk factors for coronary artery disease. If you look at the risk factors for breast cancer, they're the exact same risk factors for coronary artery disease. So all of these diseases are interconnected.
Hello! I'm Amy with Be Green with Amy, and this is Meetup episode number 17. Woo! And today we are with the Charlotte County Plant-Based Foodies, and that's you guys. Which is also a Plant Pure Communities pod called Southwest Florida Healthy Eating Group, which is also you guys. And today we have a special guest with a special presentation. There are not too many physicians out there that will dedicate their practice to the whole food plant-based lifestyle. But we are so fortunate that in Port Charlotte, Florida, we have one right in our backyard. And I would like to introduce to you Dr. Jami Dulaney, plant-based cardiologist.
Thank you. I just actually live down the road, so this is a pretty convenient speaking gig for me. So just in my backyard, ride my bike. So basically, what it is, I like to talk about what it is instead of what it isn't. But it's any fruit you can think of, any vegetable you can think of. So that's about 40,000 choices that you can have. And whole grains. And when we say whole grains, we mean the whole wheat, so the wheat berries and barley and quinoa, which is actually a seed, but we're going to call it, and brown rice. Like they are, not ground into a bunch of flours. When you go to the grocery store, you see things made into other things. If somebody says quinoa is good, then the next thing you know, there's quinoa crackers and quinoa flour and quinoa energy bars and quinoa. So it's made into all kinds of things that are not necessarily healthy, and they add a bunch of stuff to it. So we're looking at just the things as close to a carrot should look like a carrot on the plate for the most part. The beet should look like a beet. The quinoa should look like a quinoa, and that's where we're at. And we don't add any oil to things, and that's always a big question for people. Why don't we add oil? And we'll go over that a little bit later. And that means not olive oil or soybean or palm or safflower or corn, all those oils. Because again, to get those oils, you have to take 45 olives and take everything, all the good stuff out, and you're left with a liquid, and that liquid is what causes us the problem. So we try to avoid oils. Sugar also has some toxicities to it because, again, we can absorb it so very quickly. People say, well, they translate that into, well, you can't have any fruit. Well, that's not true because that fruit still has all the fiber and all the other nutrients attached to it, to those sugars. But we're talking about sugars such as table sugar, cane sugar, coconut sugar, and to some degree when I limit maple syrup and agave. So all these simple sugars that can be absorbed very quickly, we try to eliminate. And then the nuts and seed things, seeds especially, nuts some, provide us with good fat called omega-3 fatty acids. So we want some of those, but again, when people say nuts are good, then that means we have to go get the giant jar of Planters at Sam's and put it by the couch and, eat it like popcorn. And nuts are actually one of the highest calorie dense foods that we can get a hold of. It's even more calorie dense than a steak. So it's all the way over if you look at the calorie density things as far as fat goes and calories per nut and gram, so to speak. So we try to use those as more of a vitamin as opposed to a snack food. Look, it's my breakfast. It looks better there. I usually eat fruit till lunchtime for the most part. And people's like, oh my gosh. And 5 or 6 years ago, I would have never thought that fruit would keep me full till lunchtime. I run usually 5-6 miles in the morning, and it's like, how in the world is fruit ever going to keep me full? I'll need something right away. But you'll be surprised, and it's not just a tiny fruit bowl, it's a pretty big fruit bowl. So it has a whole banana and this morning it had a whole persimmon, and it had probably 10 grapes and some pomegranate seeds, and oftentimes I'll sprinkle a few walnuts, some flaxseed on top of there. Sometimes I make a granola, I'll sprinkle a little bit on for more of a topping than as the main course. And then Lunch, I usually come home for lunch and make my, the turnaround, people say I don't have time for lunch, I come home for lunch. We play Frisbee first with my dogs, then I make my lunch, usually a giant salad. This one is actually a sushi salad, so you don't take my word for it, but there's some nori up there. There's some edamame. Look, mainly what I do for lunch is I look for color. So I want to see if I have every color into the rainbow in my lunch, and a lot of fiber with it. So there's some, edamame is going to give me a little staying powder for the afternoon. A lot of times I'll throw some rice on my salad. Sometimes it's black beans, but the base is always pretty much the same. Some sort of greens, probably some red cabbage, peppers, cucumbers, tomatoes, and then add in whatever. So I can twist this and make it more of a Mexican salad. I can twist it and make it an Asian salad. I can twist it and make it a Moroccan salad, but it's all quick, it's all good. But this was dinner last night, polenta fries and some tempeh. Anybody eat tempeh? All right, so tempeh is a fermented soybean. Recently I made my own tempeh for the first time. This is not homemade tempeh, but people talk about soy. They don't want to, is it going to make breast cancer worse? Is it going to make changes in men that they may not appreciate? And the answer is no to both of those. It's soy. This tempeh is actually a soybean that you soak, take the skins off, you boil it for a little bit, and you ferment it with a rhizome, and it gets fermented, a little bit of a cheesy type flavor to it. And this is cut into strips, and I put an adobe sauce on it last night, which is a bunch of different dried peppers that I soaked, and then made a sauce out of that and marinated it and just put it in the oven, baked it a little bit. And the background is Brussels sprouts that I did with molasses and a pomegranate vinegar, and then there's some pomegranate seeds on there. So again, it's not a boring meal, and I have to say that I look forward to every meal that I have. So this is not a way of eating that is a punishment, and it's not a diet. It's something that I look forward to, and I look forward to looking at the nutrients that each meal provides me to make me feel better, to heal quicker, to recover better from any kind of athletic events. And don't watch my calories. I eat till I'm full. And so why do we do it? Mainly, the reason why we do it in my practice is to try to prevent and reverse lifestyle diseases. When I say lifestyle diseases, oftentimes we think, we're stricken with things as we get older. You get high blood pressure, you get diabetes because your family member had diabetes. We all gain a little bit of weight just because. Cancers just kind of come about. We can't avoid these things, but the reality is most of these things can be avoided. And when you look down at autoimmune disease, rheumatoid arthritis, multiple sclerosis, type 1 diabetes that occurs in kids, these are all things that occur, that is a perfect storm set up with what we eat and what our microbes are and what we're exposed to. And most of the time, nutrition can be the straw that breaks the camel's back that causes some of these diseases to rear their ugly head, but it also means that nutrition can also be used to reverse them. Interestingly, I heard a lecture when I was at a meeting this year by a physician that actually had multiple sclerosis. And she had a slide that hit home to me, because if you look at the risk factors for multiple sclerosis, they're the exact same risk factors for coronary artery disease. If you look at the risk factors for breast cancer, they're the exact same risk factors for coronary artery disease. So all of these diseases are interconnected. As physicians, over the years, way back when there used to be just general practitioners, but now we're all specialists. I became a specialist in cardiovascular disease because my family members had died of coronary artery disease. And so I wanted to know everything about the heart and how to reverse and prevent these things. But now I actually am treating all of these just through nutrition. So now I see people with cancer in the office, people with rheumatoid arthritis in the office, people with multiple sclerosis in the office, and they all have the same risk factors as cardiovascular disease. So by targeting one, you're actually targeting all of them. And it's really simple. If only we had a medication that targeted everything with one pill. You know, the pharmaceutical industry, we have 20 different pills for 20 different conditions because everybody's so focused on their own. You know, and when I'm in the hospital, I always, I'm going to tell you a side right now. So we're a membership practice. We have 175 people in the practice right now. And over the last year, we've only had 3 people in the hospital. So I went from somebody that had 10 people, 7 people during season in the hospital, or would follow with my other partners over the years, 20 people in the hospital. So I've stepped foot in the hospital 3 times in the last year because of my patients. And it's not because we just selected out healthy people. We have 39-year-olds, 3 100-year-olds, but it's the way we're practicing medicine in the office that people don't have to go to the hospital. And, you know, when I used to be in the hospital, one of the things that used to aggravate me was, you know, an orthopedic surgeon or something, or the PA would say, you know, the knee in room 212, or the gallbladder, you hear the surgeon in 111. So they weren't people, they were just diseases that were in the different rooms. But again, all these diseases are tied together, and now even osteoarthritis, which we thought was an overused disease, it's not really an overused disease at all. You know, how many women throw 90 mile an hour fast pitches? But that's one of the most common orthopedic injuries in women is rotator cuff. So all of this all these diseases are associated with inflammation and the same risk factors for all the other diseases that we traditionally treat. You can look at, you know, when we talk to people about becoming plant-based, you know, sometimes people are hesitant because it's like, well, am I really going to get all those things that I really like? And what's it going to get? What, 6 months, 2 days, 5 years? But what it really is going to get you is a longer health span, as opposed to perhaps, you know, maybe yes, I truly believe that you'll get a longer lifespan, but I'm very confident that people get a longer health span. So you know, we're all probably going to die. There's some people that are now starting to debate that, but eventually, you know, at least probably in our lifetimes, unless you're cryopreserved, waiting for a few more years, you'll probably die. But you can either live well and then die, or you can be chronically diseased and then die. You know, so it depends on how often you want to go sit in the doctor's waiting room. And so I've heard the waits are becoming longer and longer. So, you know, we have disconnects, you know, why, you know, if you go to Outback Steakhouse, there's not going to be anybody sitting around there talking about how the steak they're eating is causing their heart disease or their diabetes. And nobody really believes that steak, that one steak could really hurt you. That one piece of cheesecake could really hurt you. A little bit of sugar on my breakfast cereal, how could that really hurt you? And, you know, only old people get sick, and there aren't any old people around except those people that can't talk in the nursing home. They may be old, but if you probably ask them if they could talk, they'd say they're not the old ones either. My grandmother used to always say, you know, those old people, I don't want to hang out with them. You know, and people come to the office and they say, well, you know, I eat pretty healthy. You know, I don't eat much. Well, sometimes I eat too much bread. Well, if there's chocolate around, I eat all that. But I hardly eat anything at all, you know. And you know the people, when you go out to dinner, they're always taking the box because they can't eat it all. You know, in the car, they're probably shoveling it down, or, you know, they got the candy drawer when they get in, you know. And you know, and a lot of times, you know, I've even heard an Olympic athletic coach say vegan diet is not natural. You know, it's not natural, how fruits and vegetables can't be natural. And then the next sentence I heard him say was that he has to take these acid pills to help him digest his steak. So he can't digest what's natural, but he can, you know, the vegan thing is just too hard. And somebody else said, well, you know, I'm lucky I can do this because I have my wife to cook for me. If I didn't have my wife to cook for me, it'd be, you know, be way too hard to do it. And it's amazing what, you know, spouses can do. You know, a lot of times we don't cross-train, and maybe we've created, you know, conditions that we just need a little cross-training perhaps. And then, you know, weight loss. That's everything, you know, when you hear the paleo or the keto or the Atkins or the South Beach, all these Weight Watchers, Jenny Craig, they're all talking about weight loss. Nobody's talking about regaining health. Nobody's talking about wellness. And they're very comfortable with you losing 30 pounds and then going back to your, you know, struggling with the little portions that they send you in the mail, and then going back to your old ways and slowly gaining it back. And they're ready to sign you up with open arms when you come back. because it's all about weight loss, but it's nothing to do with health or reversing disease. And you know, we always talk to, you know, one of the things that I'm sure most of you have experienced are the why questions. You know, why do you do this? You know, how can it actually work? And you know, we tell people it's like, well, it's the only way of eating that actually has some scientific documentation, before and after pictures of coronary arteries, before and after pictures of carotids, cancers that have gone away, PET scans that show resolution of tumors. There's no other way of eating that anybody's been bothered to document any of these things. So, you know, if it's not really documented, sure, you can make anybody lose weight. You know, we can stick you in a closet and you'll lose weight, we can give you cocaine and you'll lose weight. That doesn't make you healthy. So this is a way of eating that can actually make you healthy. And of course, you know, portion control. Everybody can portion control sometimes. You can probably, you know, most people can portion control the foods they don't like, liver, broccoli, Brussels sprouts. You know, you can usually keep those under wraps, but you know, when there's a Hershey bar, people, you know, you're going to grab them. With potato chips, you're going to grab them. And so you can fight and fight and fight, and maybe you'll go 3 days great on your portion control, but then you slip off because that's human nature. And we don't have any feedback loops for some of these processed foods. And then there's always a person that's weak because they don't have enough protein. And you know, we talk about, you know, have you ever seen a thoroughbred racing horse and a Clydesdale horse? You know, Clydesdale's strong and pulls things, and the thoroughbred racing horse, you know, runs races. And they both live on oats, you know, grains. And they don't seem to be weak from their lack of protein. And there's no protein deficient doctors. So we're not treating anybody with protein deficiency unless those people are, you know, somebody that's been burned or somebody that's had some terrible disease. They're not eating, you know, they can be a little bit malnourished. But once we give people the calories that they need, the protein comes right along with it. And protein doesn't give us energy. Carbohydrates give us energy. That evil word. So, you know, healing through plant-based nutrition, it covers all the bases. You know, I had to take a hit. I'm not supposed to do any harm. Certainly plants, I've never hurt anybody with broccoli yet. And I certainly can't hurt them with any of the medications or procedures I do. You know, the food, body medicine, and then, you know, treatment shouldn't make someone, you know, if you can't make somebody live longer or live better, then why do it? Just to do a procedure so you have a shiny knee that works a little bit just because, you know, just to do something because you have to ask. We know that a bypass or a stent in someone that doesn't have symptoms doesn't make you live longer or better. But as physicians, if we see there's a spot on the chest x-ray or a spot on a mammogram or a spot or a blockage in the coronary, we feel compelled to take it out, move it, make it better. And a lot of times we don't look at the outcomes, and then we also don't look at the consequences. If you go to a surgical, they call it morbidity and mortality conference reviews, you know, a monthly meeting to look at, you know, the outcomes of procedures done in hospitals. And, you know, so they narrow it down. You know, a surgeon is a success if you get the person off the operating table, right? Doesn't matter what happens afterwards. You know, that's only as far as the surgeon's like everything went fine, but it didn't really go fine. I think it's plant growing medicine right here. Look here, click. So these are your arteries. You've probably all seen this slide. How many people own the Prevent and Reverse Heart Disease book? You know, it's page 95 of Dr. Esselstyn's book. I don't know if it's 95 or not, but the first one is your artery. You know, as you're eating, this is the artery of a 25-year-old, 30-year-old. It's already developing plaques. And this little line, this yellow, is the endothelial cell lining, and that's being stretched. And over the years, it may crack a little bit, and a clot may form, and it crack a little bit, and a clot may form, and there's a gradual narrowing. If you look at casualties from the Korean War, they've looked at casualties from all the wars, and 25-year-olds have these plaques, 25% plaques. If that plaque cracks, you know, it kind of gradually, but if it cracks and there's a blood clot that obstructs the whole artery, that's a heart attack. That's one indication for a stent, because that stent will be life-saving in that instance. But these can be killed through plants. This is just another slide, again, looking at what's inside the artery. So this it's a combination. You know, if you go on the internet, there's doctors that argue it's inflammation, it's cholesterol, it's sugar, it's, you know, on and on. Everybody picks their nutrient to blame for cardiovascular. It's actually all of them. And, you know, so cholesterol plaque may be the last thing that goes in there. You know, the foam cells and the inflammation might be, you know, what starts things out. But we have a bunch of stuff underneath that little vessel that shouldn't be there. And you can change that. You can change your inflammation by what you eat and decrease the inflammation, and that settles down the artery. If you change what you eat, the cholesterol in the fat in your diet goes down, that artery will sit down. If you eat greens, that nitric oxide that's produced by chewing greens will actually cause that plaque to heal. This is the artery to the rotator cuff. So you see it's really small. So that's why most people have rotator cuff damage, is that they have vascular disease. We think of vascular disease as affecting the heart, but it actually affects every place there's blood flow in the body, which is everywhere. And so the artery going to the rotator cuff is very, very small. And when that starts to get diseased, you get less blood flow to the shoulder and that group of muscles. You get more inflammation associated, you know, with wear and tear on the daily, and you can't clear the inflammation. You're not getting any blood flow to help clear the inflammation, and you end up having a tear. But, you know, what do? We just repair the rotator cuff, and, you know, people are left with limited range of motion of their shoulder usually. Because, again, we're going to go and repair a muscle that has limited blood flow to it to start with, and we didn't do anything to make the blood flow better. So how are we ever going to get people to resume complete function? Same thing with the hip, you know, people's, you know, hip replacements. You know, want to, you know, go to the Outback and see how many people have had hip replacements in the place. If you look at a cross-sectional area of the femur, you know, when you do a hip replacement, this is cut off and a metal ball and joint is put in there, and that cross-sectional area you can see with the naked eye all the inflammation, redness, deterioration. The bone marrow is more like jelly than it, you know, and it's amazing that any of them actually work because of all the damage that's going on an ongoing basis. But what happens? We just put a new metal joint in and hope people will go on their merry way. But you can also see when it breaks, you know, very little blood flow to the hip joint. I'm not going to get this 9-minute thing. Spine arteries. Same thing with your spine, you know. Neurosurgeon at the medical school where I trained, he said one thing that you can guarantee: if you have one back surgery, you're probably going to get another back surgery. Because the vertebral bodies are lined up like children's building blocks, and when they start to deteriorate and shift, if we artificially, you know, strap the lumbar spine with some metal struts and keep you from moving, then we're going to throw out the cervical area. If you do the cervical, you usually throw out the lumbar area. And again, the blood flow to these vertebral bodies is very small, so there's this chronic inflammation going on. This is a butternut squash red dog that I make with coconut, like a coconut curry. Definitely do this. Put cilantro on top. And yes, it's white rice. Oh. So, yeah, white rice, can you believe it? So, does white rice have as much nutritional value as brown rice? No, it doesn't have as much fiber to it. It has about the same amount of B vitamins. It has about the same amount of calories. It actually has less arsenic if you're worried about arsenic. I wasn't worried about arsenic when I had the white rice, just like white rice once in a while. But arsenic is actually in the outside layer of the brown rice, and so that's where if you get arsenic rice, if you stay away from Texas rice, you're okay with the rice. And of course, any of your carnivore friends that tell you they like to eat plant-based but they're worried about arsenic, you can say, well, then you probably don't eat chicken, right? Because most of the arsenic actually comes from the chicken poop that's sprayed on the rice fields. So if the chickens are given arsenic it's part of their feed as far as to maintain health in some chickens. So if you really want arsenic, you're better off eating chicken. You have to eat a lot more rice, white rice, to poison somebody with arsenic. ApoE4, the gene for Alzheimer's. If you have one gene, you have 3 times the risk of Alzheimer's. If you have 2 genes, which is about 150, you have 9 times the risk of Alzheimer's disease. It's like, why would I ever want that blood test? So that I can know for the next 40 years that, you know, I'm going to get Alzheimer's disease. But the reality of it is you don't have to turn the gene on. Nigerians almost all have 2 genes, and there's very low incidence of Alzheimer's in Nigerians, mainly because they eat a very high fiber diet. They never turn that gene on. We know a lot of genes are actually turned on by interaction with our gut microbes. So we have a lot of bacteria living in our colon, and once they're turned on, they can activate genes that then lead to problems. They can also turn off genes. And so Dr. Delaney has actually done a lot of study looking at genes, putting blood from people that are plant-based eaters onto, injected into cultures of either cancer cells or looking at different genes and whether you can turn genes on, turn genes off, depending on what you eat. So just because you have the ApoE4 gene doesn't mean you have to get Alzheimer's. But we know it's the transporter of cholesterol into the brain. And if we look at what causes Alzheimer's, and there's a slide down the road a little bit, part of it's cholesterol and part of it's inflammation. There's a funny thing, right? You're going to keep saying that part of it's cholesterol, part of it's inflammation. But as far as the genetic susceptibility, you don't have to turn, just like with breast cancer genes, just like with cardiovascular genes. We don't have to turn these things on. And I think sometimes you give somebody a death sentence, so to speak, when you tell them, you're doomed, that you're going to get something, but it's not necessary at all. Risk of breast cancer. The study, most of you probably have read the China study, everybody's heard of it. Dr. Colin Campbell looked at places in the world where there was a high incidence of cancer in rural areas of China. They went into their houses, they did blood tests, they actually stayed with them, they did a real good, a very thorough dietary history. It just wasn't a questionnaire that somebody sent in the mail or a phone call. They actually measured things, again, took blood, stool samples. And what they found, was that, Chinese women tend to have half the estrogen levels than that British women do. They have a much lower exposure to estrogen. The age of menarche is later. They have earlier menopause, so they have a lower estrogen load. And then animal protein. We don't think about estrogen when you think about animals, but if anybody eats dairy, milk can't be produced unless the cow's pregnant. Somebody asked me today, what about camel milk? I said the same thing. Apparently there's somebody in Sarasota sells camel milk. So goat milk, camel milk, cow milk, the animal has to be pregnant to produce milk. It means their estrogen levels are extremely high. So when we give children and adults milk, we're giving them an estrogen load. And we're also giving, with animals, we're also giving an estrogen load when they eat animal protein. So all these drives, whether it's prostate cancer, breast cancer, uterine cancer, ovarian cancer, a lot of these are driven by the estrogen. And we know that rural Chinese women that got most of their calories from white rice and steamed vegetables have essentially no breast cancer. And you can look at prostate cancer, you can look at cardiovascular disease, and the same holds true. And of course, we also found that once you start taking greater than 10% of protein from animals, that's when the risk of cancers all start to go up a whole lot more. So even in China, they didn't get a lot of their calories from animals. Most Chinese people, meat was a condiment, especially back then in the 80s and 90s when the study was done. Now we have McDonald's in China and all that other things, but back then they had a very small portion of animal protein, but you could still see in places in China where they had more animal protein, even though it wasn't a lot of animal protein, they still had an increased incidence of cancer. Again, when we try to digest something, if you digest an apple, you basically break it down into sugar, carbon dioxide, and water. So you breathe off the carbon dioxide and you eliminate the water and you're left with the sugars that you burn. If you ingest a piece of animal protein, then you break down and you have a bunch of free radicals left, you have a bunch of hydrogen ions, you have a very acidic environment. And one of the things you do with the acidic environment is you leach calcium out of your bones. So if you want to get osteoporosis, the easiest thing to do is eat animal protein and take in, and your body becomes very acidic, you leach the calcium out of the bones. Only plants contain antioxidants and phytonutrients. You know, people, if you eat the animal, you may get some as eating the middleman, so to speak. But every animal gets its antioxidants and nutrients from plants. And only plants can actually fix nitrogen. So we could live with, the plants can live without us, but we can't live without the plants. So even if you're going to eat animals, you still need the plants for your animals. And of course, if we look at breast cancer prevention, we just finished the Pink Month. Now we've moved into, if you've watched NFL football, now we're into Armed Forces this month, but still with breast cancer prevention, you see all the pink labels on everything. Get your mammogram, buy yogurt that contains pink, run a 5K, do a walk. But the reality of it is we actually need to prevent this disease that occurs in 1 in 8 women. And it's certainly doable with what you eat. It takes 1 billion cells to make a tumor about the size of your fingernail. So by the time it's detectable, you already have 1 billion cancer cells that have already been initiated. So by doing a mammogram, we're not detecting cancer earlier. Well, we're detecting a cancer earlier, but we're not making people live any longer. We're just making people live longer with cancer. So we've not done anything from really life extension with most of our medications. We really need to just eliminate the problem or have that tumor shrink before it becomes a tumor. And exercise plays a huge role. Women that exercise have much lower incidences of breast cancer, and they have much lower incidence of breast cancer recurrence. If a woman exercised and then stopped, her risk goes back to when she, was before. So it's not like you can exercise for a couple of months and then stop it. You carry that protection for breast cancer and breast cancer prevention. It has to be a lifelong thing, and it has to continue. Body weight, with our young people being more and more overweight, there's, people are worried about body shaming. We don't want to talk about people's size, but the reality of it is it's not size, it's not weight, it's cancer risk. And adipose tissue, especially adipose tissue in the midline, bless you, is associated with increased risk of cancer. So not only is weight increase associated with increased risk of diabetes, but it's associated with increased risk of cancer because fat cells actually produce inflammatory and growth factors such as tumor necrosis factor, interleukin-6, interleukin-3, insulin-like growth factors. So all these factors actually will stimulate an abnormal cell to start to grow and divide more rapidly. So when people are overweight, they're still carrying that risk of cancer, despite maybe having a normal blood pressure, despite maybe normalizing their, with medications or normalizing their glucose with medication. And, and again, a low inflammatory, we want to decrease the inflammation in the body. So if people are eating a lot of sugar, if people are eating a lot of fat, then they have a lot of inflammation, and that increases the risk as well. Pringles. So Pringles aren't even a potato in Canada. They don't have to pay taxes as a potato and vegetables that Pringles makers. Because it doesn't, there's so little amount of potato in them that they can't even call them a potato chip. And so they're made from, like a bunch of ingredients. Yesterday we were watching TV and there's an advertisement for Burger King that you can get, I think it's 10, but it could be 20 nuggets. Is it 10? 10 nuggets for $1. And we were laughing. It's like, so who thinks, how much chicken do you think you're getting for $1? I know McDonald's chicken nuggets, there's 36 or 37 ingredients. But when you do the math, how could you think that you're buying these nuggets for your children and you're getting 10 of them? What part, even if chicken were good, how much do you think you're actually getting? And if we go back to Pringles, you know, there's acrylamides caused by baking and frying things. So when we put something over 500 degrees or we expose things to high temperatures for prolonged time, we actually generate carcinogens. So baked chips are actually worse than fried chips. Yeah, did not say, for the record, I'm going to look right to the camera, that you should eat fried potato chips. No chips is the way to go. But when you, we have this false sense of security that, oh, I ate a few baked chips, you know, a few baked Tostitos, or, you know, I don't eat chips, I eat Tostitos, or, you know, I mean, we have these ways of making these little deals with ourselves. You know, if you look at these acrylamides, you know, 6 ounces of French fries, you know, it's tremendous, 500 times the allowable amount of these acrylamides. So go ahead and do, you know, hash browns for breakfast and French fries at lunch and a few chips at dinner, and look at the carcinogens that you can get just by eating vegetables, so to speak. And of course, everybody knows when you go to the grocery store that they put the healthiest chips in the deli, right? So the beet chips and the kale chips, they're the healthy ones because they're in the deli and they have the better packaging and they cost more and there's more air in the bag, so that's better for you. The air is probably, I don't know if the air is okay either. But there's really, you know, not much in the way of beets and beet chips or kale and kale chips. It's all, again, I'm eating kale chips. And I'll even take it one step further. The people that say, oh, I got that air fryer, you know, I get emails, what kind of air fryer do you think I should get? And so we're going to take, you know, a vegetable, kale. It's like I can eat a whole head. I had a lady say, I can eat a whole head of kale in my air fryer. And of course, they swear to me, I don't use any oil. I don't use any oil. Just put some, you know, balsamic vinegar and nutritional yeast, and I don't use any oil. But how does that fill you up if you eat a whole head? I dare you to eat a whole head of kale raw. I mean, I can eat 3 or 4 big stalks at lunch, but I got to cut them up pretty good. And I get, the leaves. I even give the stalks. I even cheat. I give the stalks to the dogs. But I'm pretty sure I can at lunchtime. Even at night, Linda knows I chew really fast. I couldn't get the head of kale down raw or steamed, probably even. You know, the whole. But so when you eat this stuff in the air fryer, you don't have any caloric concept of what you've just eaten. Now it's just kale. But it didn't fill you up, so that meant all that other stuff that you're going to have, because you have to fill yourself up some way. You're not going to be full after a head of air-fried kale. So you're going to need something. That's when you're grabbing for the nuts when you go by, and you're grabbing for the cookie when you go by, and you're grabbing for the extra this when you go by, because you're not full, because you just ate this air that was, you know, these dehydrated leaves. I tried to dehydrate oregano in my dehydrator, and I didn't put anything on top of it. And so it has a fan in the back. So what do you think happened to my oregano leaves when they got dry? You know, I was like, they were all over the room. You know, so it doesn't take any, you know, when you take the water out, you have nothing on it. Same way, you know, not to make the point worse here, but, you know, even the old iodine fries, you know, have a fair amount of bad things associated with them. And that's, we haven't even got to the oil part. There's some vegan sushi for you. Still looks better in the back. So I make sushi, you know, usually cucumber, red pepper, little avocado, carrots. The nori provides a source of iodine. So if you are a really good plant-based eater and you don't use any iodinized salt whatsoever, and you never eat any sea vegetables, you can run the risk of iodine deficiency. We can't test for iodine deficiency unless you do a 24-hour urine collection. That's kind of cumbersome. But what we do test people for are T4, thyroid hormones. So they won't actually be able to convert enough of their thyroid hormone. So we do check people that, and most of the time, if you eat out at all, or you run into a little iodinized salt, but it's a reason not to really. You know, people say, I eat Himalayan sea salts. You know, it's not better for you by any stretch of the imagination. It doesn't have iodine in it most of the time, and it still has the same amount of sodium in it. So it doesn't do you any good to eat Himalayan sea salt. So you're better off to be exposed to a little bit of iodinized salt. A quarter teaspoon a week probably gets you, but I like to get mine through the nori. If you cook your own beans, you can cook kombu, which is a sea vegetable that you can buy at the store, and cook with a strip of kombu. If you buy Eden canned beans, they are actually made with kombu, so you get some iodine. Most of the time, my grandmother had diabetes. It was called sugar diabetes, meaning don't eat sugar and you'll be fine, but that's not true. So people try to not eat cakes and candies, but they still have high glucoses, and then they're saying, I can't eat fruit, so we're not going to eat fruit, we're not going to have any antioxidants, phytonutrients, so we're going to have all those other bad things happen to us. But the reality of it is people become a diabetic because their cells are clogged with fat. So, you turn 21, you don't get any more fat cells, you put as much fat in them as you can, then it starts to spill out over into your liver and your pancreas and your muscles, and the glucose that we need to burn, use for fuel, can't get into our muscle cell, and then the glucose goes up, so that's really what gets us diabetes. So this is just another picture. So this adipose tissue in the belly associated with a lot of inflammation. When you get fat to the muscle cell, think about Delmonico steak, marble, very tender, but again, can't get glucose into the muscle cell. So that's why people are tired when they have diabetes. When it backs into your liver, you get fatty liver. It's the #1 cause of cirrhosis in the United States. Once you get cirrhosis, it's game over. You get fatty liver, it's reversible if you change your diet. This is my slide looking at diabetes. So we have a muscle, and we have a sink, which is our blood vessel. So you got the stomach up there. So if you eat an apple, you have glucose. Glucose has to get into your muscle cell, has to uptake it, and if the muscle is blocked with fat, and the apple, the glucose can't get into it, then your body has to secrete more insulin. And when your body secretes more insulin to try to get that glucose into the cell, it causes breakdown of triglycerides from the fats, your fat stores, and so your triglycerides go up. So one of the first things we see about people that have glucose intolerance is their triglycerides usually goes up. Well, the first thing that your doctor will do is put you on a medicine for your triglycerides. It's like you need to treat what's causing the triglycerides, which is the high insulin. So when you have high insulin levels, obviously you have high all these growth factors that cause your blood vessels to, so if you just have glucose intolerance, you have all the same risk factors for everything that happens after you get full-blown diabetes. So your heart disease risk is increased, your kidney disease risk is increased, your chance of blindness is increased, your vascular disease increased risk, your cancer risk is increased because you have these high insulin levels. So your body puts it. So if you eat, it's like, that slide was supposed to be like a sink at Thanksgiving. So if you have the sink that's not draining very good because it's clogged with fat, and the water's slowly draining down, and you're just about finished, and then somebody comes and they put the turkey platter in the sink with all that fat on it again. So now the water's back, you're stuck again. So that's like we eat. So if you have an apple with peanut butter, you're eating an apple, and that peanut butter is going to clog that drain a little bit more. And when you go to eat your salad at lunch, that peanut butter is still clogging that drain. So until that peanut butter clears, you're still going to have high glucose, and it's going to take time for that glucose to get in. So when I have my diabetics check their blood glucose, I have them check it 3 hours after they eat, because in the people that aren't diabetic, their glucose should be back down around 90 or 100 in about 3 hours. If theirs are still elevated, there's something that's causing the glucose not to go into the cell. So most likely, then we check back, and I'll say, what did you have for dinner? And about 20 minutes later, they may or may not fess up for what they had for dinner, but then, we'll go back through, and it may be that they had a bagel with cream cheese at breakfast that set them up for high glucose the whole rest of the day. Because that cream cheese was still hanging, that fat was still hanging around the bottom of that drain, and the glucose can't drip in. So to treat diabetes and reverse it, we need to get the fat out of the drain and the fat out of the diet. So the fat in the drain is basically how people lose weight. Well, when they change their diet to plant-based, again, they're not taking in near as much fat, about 10% of the calories are fat. So all of a sudden, things flow in a lot easier. They're eating less calories, and the weight comes off, and the diabetes goes away. Now, somebody should say, well, what about this keto diet, doc? Because my neighbor went on the keto diet and their hemoglobin A1C completely normal. They're cured. It's like, yes, they are cured until they're cured because they're not taking in any glucose. So if you measure glucose when you're not taking in, it's going to be negative. It's going to be normal, right? But at the minute that person takes in any glucose, it's going to go straight up because the keto diet is all about eating a high-fat diet. So they're blocking the drain, blocking the drain, blocking the drain. As long as they're not taking any glucose, you can't measure the glucose, it's going to be low. But it doesn't do anything to improve their glucose metabolism. So it's not a cure for diabetes. It won't reverse it. It temporarily controls it at best. But it doesn't control all those secondary side effects of the high insulin. So again, risk factors for cancer are the same risk factors, overweight, diabetes, eating animal protein, microbiome we haven't touched on yet, toxins we have talked on in the last, lack of antioxidants. When you're not eating good, or when you're eating bad, you're not eating good. So if you're eating Oreos, you're probably not eating fruit. So if you're not eating good, you're not getting the antioxidants and the nutrients that you need, then you're not helping yourself, even if you're not, doing a huge amount to hurt yourself. Risk factors for autoimmune disease, same thing. So the microbiome, the bacteria in our bodies. So we have, so much DNA, but we have a lot more DNA now through bacteria than we do our own. So really, the bacteria are controlling our bodies for the most part. And depending on the bacteria that you harbor in your colon, you may extract more calories. If you have good bacteria in your colon, it may feed back and tell your liver not to produce as much cholesterol. It may feed back to your liver and tell it not to produce as much glucose. Those bacteria can also produce short-chain fatty acids that go on to produce dopamine and serotonin, so they help with depression. They can turn on your immune system so that you're attacking your body for no apparent reason. They can actually cause an endotoxemia that's associated with a low-grade bloodstream and poisoning. So we know, people have heard of E. coli poisoning from tainted vegetables. Usually tainted vegetable, but tainted anything. And what kills people is not necessarily the bacteria, but it's the toxins that the bacteria release is what causes this overwhelming infection. People drop their blood pressure, they leak out all their fluids. So when you eat animal products that are associated with these bad, and we select for these bad bacteria, you get this low-grade toxemia that maybe you've had it. You have the big steak and you just don't feel good, your stomach kind of hurts, you have a little bit of headache, you might have a little bit of chills. It's a low-grade infection that people get, and it's all because of the bacteria that we eat and the bacteria that's produced in your stomach. That's potato cheese sauce over zucchini and mushrooms. I never thought you could make cheese out of potatoes, but you can. It's really good. So, again, you may be saying, I really want, and even our cravings sometimes are controlled by our gut bacteria. We know that they turn on leptin, turn off leptin as far as being able to control, yes, you're hungry for this, you have the wants, I just keep looking, open the refrigerator door, open the refrigerator, get the wants. Sometimes, you can blame your bacteria on it to some degree, but if you eat, if you've eaten really rich Thanksgivings coming up, of yesteryear, that really big Thanksgiving dinner with the pumpkin pie and all the sweets, and you're stuffed and you feel awful, and you're just like, I just have the wants for something. Just have the wants for this, because you're not eating the right thing, all the other stuff. You have the wants for something. It's just because nothing's been turned off. You're still looking for the right thing. And then, dementia. We talked earlier about the cholesterol, and certainly we know that dementia is affected by the blood flow to your brain. You need blood flow to bring glucose to your brain. Your brain uses more glucose than any part of your body. So you have to get glucose to your brain. Your brain runs on glucose. So if you're going to do the keto diet, your muscles are still going to break down enough glucose to feed your brain, because they're only going to function. You can function on a little bit of these ketone bodies in second gear, but you can't really function unless you've got some glucose going into the system. But you got this mild inflammation And so we know that sugar also causes inflammation around the cells. So we have, when you have a neuron's like a spider, and all the connections to other neurons are by these little legs. And as we get older, the little legs fall off, so to speak, and we lose connections between our neurons, and then things start to shrink. And so we know that sugar actually attacks the little connections, the glia, and all some of the inflammation cells around the brain. So when we eat, the simple sugars, it's kind of an inflammatory reaction in our brain. So, when you're just going to have that once in a while thing, it's just a little bit of a hit to your brain. So people talk about brain fog, and living on sugar, or kids misbehave when they've had too much sugar. It's a little bit of inflammation going on. So if you hook inflammation with a decrease in blood flow, then things can get bad. There's this immune response. Before there was a study done on nuns that they looked at them when they first went into the convent. Edit that out. When they first went into the convent, and I could make a really bad joke if I want to. They did have to do a writing test and describe what, the reason why they wanted to go into that place. And the nuns that were very descriptive and used a lot of adjectives and were very good writers versus the nuns that were black and white, just because. When they followed them 25 years later, those nuns were less likely to get dementia or have cognitive impairment, despite what their MRIs of their brain showed. So they could have a really ugly MRI of their brain, but they'd be functioning just fine. But and some of the people that didn't have those skills developed would, despite having a better looking brain, wouldn't be functioning. And so, what you do with your brain, you have to, use it or lose it. It's just like a muscle. And so the more it's developed early on, the better. And they actually know that, kids after college, you start losing, you have to start having brain decline. So unless you're doing something to actually stimulate your brain, and word searches won't do it, you have this decline. And so people that retire early, hey, great, but if they're, just sitting on the porch, then you can have this huge cognitive decline. You have to really work to keep it. And some of the things that do work to keep it is, doing things that require more than one activity at a time. So if you were going to do a word search versus playing cards would be better. Because when you're playing cards, you're counting, you're looking at your cards, you're interacting with the person next to you, having maybe a different conversation. So the things that, again, these little connections, you want to build a connection, something that stretches you just a little bit beyond, a little bit more of a challenge. If you can't, trying to put something together that's not your forte, or trying to do something, play a piece of music that maybe not just quite right for you, just a little bit of a stretch really does things, helps to connect things. And, it's kind of funny because it all circles back to, you tell your children, it's not worth, if it's not worth working for, and putting in some effort, it's not worth it. But then when we become adults, it's like, how do we do this? How do we not sweat? How do we not have to think? How do we not have to, but the reality is we have to keep doing that if you want to keep it in line. And the other thing is, because the brain needs so much energy, it needs a way to get there. So there was another study that the people who have the strongest legs have the strongest brains. So if you use your legs and your legs are strong, then you get blood flow to your brain. You clear inflammation to your brain. You produce these little powerhouses when you develop your muscles called mitochondria, and they clear inflammation. They bring oxygen. They're little energy producers, and you have to get the blood flow up. So if your legs can drive the blood and you can metabolize oxygen and glucose, you have a better chance of keeping your brain. So we know people that do weight training actually keep their brains better than people that don't. Cardio is good, walking, but you got to keep your legs strong. So it's important to always keep your legs strong. So squat you must. Could be over. That's pretty much it. So as far as my last exercise, slide, You know, it's something that you should do every day, and huffing and puffing is good. And we just, again, pushing yourself just a little bit further than is comfortable. So we do things in our membership practice like push-up challenges. And so, you know, from age 27 to 87, we have people doing some sort of a push-up. So whether it's on the wall, or on the bed, or on the ground, they do push-ups. We do squat challenges because you have to do something that just challenges you a little bit physically every day to keep it going. So you can't, you know, you stop, you lose it. So take home messages. If you don't use it, you lose it. Eat green. If you want to find me, there I am. You know, I'm on Instagram, so I put what I eat on Instagram, so if you want to see what I eat. You know, as foodies you all are too, you get your plate of food, you take a picture of it, you know, and nobody else wants to hear about it, but you know, at least I posted. You can take a nutrition class through our office. You don't have to be a member of the practice if you have some interest. And I'm on drdelaney.com if you want to email. Jami at Dr. Well, that's our website, and Jami at Dr. Delaney. We have a level 1, level 2, level 3. They're about an hour and a half. I cook. People eat, and then they taste. We discuss recipes. We discuss problems. I do a talk that's new every class, and we tailor to who's in the class and try to keep learning new information. So it's nice that people can come in and, you know, share just like you are the trials and tribulations. You know, I heard today about developing a new habit. You know, changing a lifestyle is huge. Next to religion and politics, nutrition is probably the next touchy subject because it has to do with our tribe. We all want to belong. We all want to be part of a tribe, whether it's your tribe or your family, the tribe of the people you go out to dinner with, your church, whatever. And then all of a sudden, when you decide you're going to eat some way different, you're actually threatening yourself that you might get kicked out of the tribe. You might, be ostracized from the tribe. And a lot of people, and a lot of you probably experienced it a little bit. So it's nice to have a tribe. So we try to provide a tribe in the office of like thinking. And so you can go on and there's papers back there if you'd like some recipes from us and fill out or more information. You can fill those out. But I think most of you know where I live. Yes, ma'am? Yes, good idea. So every year, doggy people here. Every year we do a plant-based nutrition conference. This year is going to be March 30th. It's a whole day. We have plant-based, no salt, oil, or sugar breakfast and lunch. And this year we're having Dr. Alan Goldhammer as our keynote speaker. And he's from a practice in California called True North Health, where they actually do water fasting to reverse disease. And I'm trying to get him to talk about, there's a new blood test that's coming out. It's probably going to be released soon, that you can actually detect cancer before you can find those little tiny tumors. And so if you know you have breast cancer but you don't have a tumor, or you know you have colon cancer but you can't find a tumor, then what do you do about it? And he has some early data that if you actually do a water fast, you can actually make that test go, kind of get those cells and start your body eliminating those cells before they are ever gathered enough to cause a tumor. So there's a lot of exciting things going on in the world of fasting, especially with longevity. And there's some controversial things that are going on, or some, again, if somebody says fasting is good, well, how do we do it easy? So people talk about doing, the keto bombs or the butter coffee, so that'll be a good day at the conference. I'll be speaking. My daughter's a registered dietitian. She'll be speaking, and we've also, because of the overwhelming response to Nathan last year, we're having our strength and conditioning coach from Georgia State give a lecture as well. Yes.
I'm curious about something. I've been doing some experimenting with beets, and you can eat beet greens, you can eat beets. But when you scrub the beets and boil them, can you drink the water?
Sure. it won't hurt you. I mean, you're gonna, so when the water turns pink, you're leaching out. The color is where the nutrients are. So, you know, I guess it's somewhat of an old wives' tale to some degree, but my grandmother would cook beets, and she would say never cut the top, never cut, you know, you leave about that much of the stem so the beets didn't bleed as much into the water. And it's, you know, it's basically they don't lose as much nutrients that way if you don't cut the, you know, you don't, the water's not as red, but you can drink the water.
I know how you use it, it's like,
People use it part of their vegetable broth, yeah. Yeah, it's not going to hurt you, you know, you know, I don't even worry about, you know, I get the mud off, but I don't worry about, you know, yeah, exactly. It's a sort of, you know, so you're going to, especially if you're cooking, you're bringing your boil in it, so you're really not causing too much of a problem. So I just usually cook them with the skins on, and then peel them off, and you know, the part that's.
You cook them with the skins on.
Yeah, I don't. Yeah, I take the really ugly part off, but otherwise I just.
The reason I asked, when I was little, my mother used to always use spinach for it, like you make spinach, and she'd put a little butter and salt. But I remember drinking it as a child, and then I was thinking as I'm working with bees and trying to design different ideas.
Yeah.
But yeah, because this whole thing of the bee, what do they have to?
Nitric oxide. So beets are one of those nitric oxide producing vegetables. So for you new people, if you eat beets or kale or cabbage or cauliflower, it interacts with the microbes in your tongue and the amylase in your sputum, and you actually produce this nitric oxide that will lower your blood pressure and dilate your blood vessels. So it's good for you. Yes, sir?
How helpful are these beet extract drinks that they market?
Yeah, exactly. Market. Not eat your beets. You know, the beet powders. You know, again, when you take something and first of all, if you were going to do an extract, how would you make money on it? So you're going to take the beet parts that are left, you know, the part you cut off, and the other parts, and sweep those all up and put them in some sort of bath and dehydrate that down. Usually, you know, so you're not getting the cream of the crop when you're going into a powder for starters. And, you know, then you're just going to, you know, so you're really not getting the nitric oxide producing potential.
If you have beets in your diet as a regular thing, and this beet juice as an addition, does it provide any help at all?
You know, I mean, unless it's actually juice beets.
So you'd be better off drinking it.
You'd be better off drinking the water than the supplement, yeah. I wouldn't waste your money on it. You can buy a lot of beets for the beet powder price. I think it's like $40 for some of this stuff. Yes?
What's your favorite salad dressing for your salads every day?
Well, you know, so I have those three go-tos. So that's pretty much my salad. So the one is more of a Mexican twist, and so I do salsa. And then the other one is the kind of my Asian one with the nori, and for that one I do a little bit of like soy sauce and pickled ginger. And then for my Moroccan, I do lemon juice, and then I use turmeric and cardamom and cumin, and I put all that together and a little bit of ginger and mix that all up. So those are usually what I prefer. Sometimes, you know, my mom's Italian. She does, you know, we do balsamic vinegar at night just with a regular salad There's a lot of different flavored balsamic vinegars. But that's usually, I keep it pretty simple. It's funny because I thought, you know, we were always Italian. I grew up, it was oil and vinegar. You know, I mean, Italian type of dressings. That was really all. My dad did double with cheese, but my mom and I was Italian, and it was like, well, how are you going to make it? You know, vinegar just doesn't stick to the leaves and all that kind of stuff, and you know, or can you eat a salad plain and all that? And you know, the more I eat greens, the more it's like the dressing has really become secondary to the other stuff. So, and you know, avocado. If your cholesterol is not really, really high and you don't have, you know, half avocado a day, I think is perfectly fine to help give you a little fat feel in your salad. Some diabetics can't tolerate it, you know, if you can play with how much you can tolerate, maybe a quarter, but it gives you a little bit of that fat feel. Some people take their walnuts instead of putting them on the breakfast salad, but mix them with some balsamic vinegar. You all do that. You can do the balsamic vinegar and a few walnuts, and you can add raspberries or blueberries to that, mix that. That makes you know, more of a flavored vinegar that's good. Or just use the flavored vinegars, like a big vinegar occasionally or something along those lines.
Or spooning them on this mix of vinegar.
Yeah, you can take hummus and water it down. Hummus and salsa kind of makes a Thousand Island dressing. Hummus and a little bit, you can make that more of a, a sweet dressing. But Anita does another thing I like is just mustard. So I'll do mustard and mustard and horseradish, or that's actually, it sounds goofy, but it really is good. And nutritional yeast, that's good on the potato as well.
I'm working with something today, and it was Dr. Esselstyn, and he was talking about, like, he does it in the kale and he puts vinegar on it.
Yes. So balsamic vinegar actually increases the nitric oxide potential of the kale, cabbage, cauliflower. So the reason why he eats it 5 times a day is when you eat say a cup of kale, then when it hits when you chew it, that's why we do like the chewing better than the smoothies, and you swallow it, about 15 minutes later, you can actually measure a rise in nitric oxide in your bloodstream. And then about a half hour, 40 minutes later, when it hits your small intestine, you actually get a second bump of nitric oxide. But it goes up and then it goes down. So if we have somebody that has chest pain because of not getting enough blood flow to their heart, or they have leg pain because they're not getting enough blood flow to their legs, and they eat their cup of kale and they get the nitric oxide production, then they don't have any pain in their legs. But it's short-lived. It's a short-acting medication. So by eating 4 or 5 cups a day and scattering it out, you're getting that trickle of nitric oxide. So not only does the nitric oxide dilate the blood vessels, and for the plumbers out there, if you dilate by a factor of 1, you increase the flow by a factor of 4. So just a little bit of increased diameter, you get a lot more blood flow down the blood vessel. And then over time, if you keep doing that day after day after day, the nitric oxide actually eats away at that plaque. The vinegar actually potentiates that reaction. So it makes you get more bang for your buck. You get more bang for your buck with the vinegar and a little bit quicker. So the balsamic vinegar, and a lot of people grew up eating cabbage and vinegar, Brussels sprouts and vinegar. So it's one of those Ohio things as well. But it does actually have some potentiating, getting the nutrients out of it more so.
If you massage the kale with the vinegar,
It'll break it down so it's not quite so, some people don't like to chew as much. Yeah, Some people's teeth are sharper than others. Yeah, lemon juice will work too. You can use lemon juice to massage the kale, or even a little bit of the avocado. That makes it nicer steam. Yeah.
But I knew it had something to do with it.
Yeah.
And I knew it had to do with, he wanted 5 or 6 times.
Slow drip it in. Yeah, it's amazing how it works.
So that could replace a statin.
That would actually replace your nitroglycerin, or your people take indoor isosorbide, or replace your blood pressure pill potentially. So it will lower your blood pressure enough to get off blood pressure pills over time. The statin, basically by eating plant-based, we're going to take your cholesterol down and actually get rid of it. So the other thing about the microbiome is, so good bacteria tend to like fiber. So the more fiber we feed our gut, the more good things that they make. And one of the things they'll do is to keep your liver from making so much cholesterol. Only animals have cholesterol, so if you take the animals out of your diet, you still have black cholesterol if you're eating fat, because plant fat can be converted into cholesterol. So it was plant fat, any kind of fat can be converted into cholesterol. All right, it's nice to see you all.
Thank you.
You're welcome. That concludes our service.
Well, that was a wonderful presentation, and I hope you click on the comments below and tell us what you think. And remember, click up here to subscribe. And until next time, be strong, be well, and be green with Amy and Dr. Dulaney, plant-based cardiologist.